Hi, today we'll be demonstrating the design process for surgical guide for a single tooth implant case using Exoplan software. Here, what we do is first of all we select the patient particulars and enter the data, and then we open the Exoplan software. Once the Exoplan software is opened, it asks us to load the DICOM data first. We search for the DICOM data of the patient in our folders and then load the DICOM data into the Exoplan software. Here we are now loading the data into the software. Now the DICOM data is loaded and we adjust the transparency of the data so that we see the bone available and the bone is nicely available. Then we go to the next step and it asks us to make the panoramic curve. Since this is a small field of view, so the software does not make the curve very nicely by itself. Otherwise, if we have a full arch DICOM data, the curve is usually made very well by the software AI automatically. We don't need to do much about it. Then we go to the next step. It asks us whether we want to attach a STL file or not. So now we are attaching a STL file to the Exoplan software. Once the STL file is loaded, then we can match these two files together using some common points which are seen in the data. Here we'll be using 3 points on 3 different teeth, and usually what we recommend is to have a larger view of DICOM because it helps us to have some widespread points and it helps in the accurate matching of the data together. But here also we can match the data, but in some cases it becomes difficult for matching the data with small field of views. So here we'll mark 3 points on this. One is on the molar, one is on the premolar, and the third point will mark on the lingual cusp of the second premolar, sorry. So now the software attaches and merges these data together using AI. Once we click OK, then the data is merged together. We can check whether the data is accurate merged or not by these 3 views that we see. Next we go to the best fit matching, and the software tries to make the best fit. As we can see here, the data is very accurately matched because we can see a lot of blue portions. Blue means the data is accurately matched. So now we can go ahead with the acceptable alignment. See, we can check in the different views. The green line is the STL view and otherwise it's a DICOM view. So we can see the outline of this green matches perfectly with the outline of the CBCT data. Then we go to the next step and then we mark the nerve. We can mark the nerve by clicking on the point in this 3D view, and then we can go and mark the nerve in these different views. These different views are used to visualize and mark the nerve accurately. We can see we can mark the nerve. Now the nerve has been marked, so we go to the next step. Next, it asks us to load the model tooth. Since we have not loaded the opposing arch yet, so we'll go to the expert mode and then add the opposing arch, the antagonist, and we load the upper jaw, and we see it is already aligned to the lower jaw. Now we can manipulate the position of this tooth to be in the best prosthetically acceptable position for our case. This video is totally uncut and totally real time, and exactly the time it is taking to do these things. At this time, we just need a tentative placement of the prosthetic crown, not an exactly 100% accurate as it will be in the finals, but we get a idea where the final crown will be positioned, so that we can plan our implant accordingly, and the screw channel can be designed to fall into the occlusal place into a desirable position as we want it to be. So once we are satisfied with the position of this crown, then we can go to the next step. Some minor adjustments are being made. And now this placement looks acceptable. So we go to the next step, and now it is the position of the implant. So we choose the company of the implant that we need to put, and the type of implant and the size that we want to put. Here we are choosing an Ostem TS series and 5 mm diameter implant. It is placed into the tentative position, and then we use these 3D views to align the implant in the most favorable position. We can rotate it 360 degrees to see the placement of the implant in 360 degrees in relation to the other teeth, other implants, nerve, etc., and whether we have some bone exposed in any of the threads. This white line that you see around the implant is a safety distance, so that it is we can control it at a, usually it is default at 1.5 millimeters, but we can control it more to be more or lesser as per our preference and the requirements of the case. So we can rotate it 360 degrees and then exactly check how it is going to be placed in the bone. And now we can also see the screw channel that will be emerging from the crown. So we see the screw channel is coming from the occlusal surface. So we can still make some minor changes to make it more favorable, like the screw channel can be made little more lingual, so that it's more in the center of the crown, and also some mesiodistal slight adjustment can be made. And this is how the implant will look like. It looks perfect now and in an acceptable position. So then we can choose the surgical kit that we are going to use. At this point, we can increase or decrease the length and the diameter of the implant as required. Then we choose the Ostem 1 guide, and the closed sleeve will be used. So we choose this thing. At this time, a report will be published about the implant planning. This report is sent to the doctors, and after the doctor approves the report, then we go ahead with the surgical guide planning. Now we'll go ahead with the surgical guide planning. These parameters are being set for depending on the printer that we are going to use. and other factors. The technical aspects are there for some offset and how loose or how tight we want our guides to be and our drills to be. After that, it is the direction of insertion of the guide is being decided and the offset is being decided. These parameters depend on the printer's settings. After that, we go ahead in designing the outline of the surgical guide that we want to make. This is the outline. Once we press apply, we will see how the guide will look like. If we want, we can change the outline at this point by dragging these points into different places, like here. Now we are taking it, extending the guide a little bit more towards the mesial. Now you can see after applying, it is now slightly larger. Next, we create some window on the anterior portion so that we can check whether the guide is seated completely or not. This is how it will look. Some adjustments can be made depending on how we want it to be. And then we add some patient's name for identification of the guide, and we also attach our own logo and the name of Warau here, and then we go to next, and the guide is going into the merging process. All the data is being merged into a STL file. See, this is the guide that we have formed. At this point, if we want to make some changes to the guide, if we feel that it is getting small, shorter or thin at some places, so we can modify it and freeform it at this point, and otherwise we can just go ahead and save it as an STL. This will be saved in the folder as an STL file. Thank you so much for listening to this, and if you have any questions, please feel free to ask in the comment section, and we shall be more than happy to answer your queries in the comment section.